Hello, and thank you for your interest in the Forensic Pathology Fellowship at the University of Michigan. The Wayne County Medical Examiner's Office partnered with the University of Michigan in 2012, and our fellowship training is in both the Wayne County and the Washtenaw County Medical Examiner offices. My name is Dr. Lee Lavity, and I am the Fellowship Director. We have put together this virtual tour to introduce you to our fellowship in lieu of a site visit. The Wayne County Medical Examiner's Office is located in downtown Detroit. The office services both Wayne County and Monroe County. Wayne County is a large area with a population of 1.7 million. Monroe County is south of Wayne County, extending to the Ohio border, and it has a population of 150,000. Due to the size of Wayne County, there is a diversity in both people and environments, as it contains a major urban city, is more rural or suburban to its west and north, and it is bordered by lakes to the east. Our caseload is high, with about 3,400 cases per year, and it is very diverse and ranges from previously undiagnosed natural diseases to complex homicides. The office is NAME accredited. The Washtenaw County Medical Examiner's Office is located in downtown Ann Arbor. The office serves both Washtenaw County and Livingston County. Washtenaw County has a population of 367,000, and it is home to the University of Michigan. It is a county with diverse landscapes, and Ann Arbor is frequently on the list of the best U.S. cities to live in. The Washtenaw County office has a caseload of about 700 cases a year, and it offers a higher percentage of natural and drug deaths than traumatic deaths. The Washtenaw office is NAME accredited. Currently in the Wayne office, we have 5 full-time forensic pathologists. These include Dr. Carl Schmidt, the Chief Medical Examiner, myself, who in addition to being the Fellowship Director is the Deputy Chief Medical Examiner, Dr. Lachman Sung, an Assistant Medical Examiner who is also the Anatomic Pathology Assistant Student Coordinator, Dr. Omar Reyes, an Assistant Medical Examiner who is also the Resident Coordinator, and Dr. Teresa Wen, an Assistant Medical Examiner who is also the Medical Student Coordinator. In addition, we have 2 forensic pathologists, both of whom are former fellows, working as locum tenens on weekends. And we have also hired 2 more assistant medical examiners and 1 more locum tenens that will be starting summer 2021. Currently in the Washtenaw office, we have 4 forensic pathologists. These include Dr. Alicia Wilson, who is Director of Autopsy and Forensic Services at the University of Michigan, as well as Chief Medical Examiner for Washtenaw County, Dr. Jeffrey Jensen, an Assistant Medical Examiner who is the former Director of both the Fellowship and Autopsy and Forensic Services, Dr. Michael Kaplan, an Assistant Medical Examiner, and Dr. Myra Khan, also an Assistant Medical Examiner. Both offices utilize the same consultants, and these include Dr. David Gordon, a cardiovascular pathologist, Dr. Gary Berman, a forensic odontologist, Dr. Megan Moore, a forensic anthropologist, and Dr. Sandra Camelo Paragua, a neuropathologist. The Wayne office has a full complement of staff. We have 3 forensic-trained pathologist assistants. Our PAs received 8 weeks of forensic autopsy training at our office as part of their formal education, and they are flexible staff that can perform a variety of tasks depending on the work and flow. These tasks include, but are not limited to, performing autopsies, taking photographs, evisceration, specialized autopsy dissection techniques, taking x-rays, supervision of rotators in the autopsy room, packaging of toxicology kits, packaging of COVID and viral swabs, onboarding of monthly rotators, and the organization of research projects. Other Wayne staff also include 7 autopsy attendants, 2 biomedical photographers, 11 investigators, 4 clerical staff, 1 histology staff, and 2 custodial staff. The additional staff in the Washtenaw office includes 9 individuals with the dual responsibilities of autopsy attendant and medical legal death investigator, 1 biomedical photographer, and 2 clerical staff. The Wayne office offers all the necessary amenities needed for a high-volume, complex center. Here is the main lobby of the Wayne office. As you can see, we have ensured that our office is compliant with current COVID measures. We are affiliated with the University of Michigan, Michigan Medicine. The county entered into a partnership in 2012 with the university to provide forensic services to Wayne County. Our staff and resources are university, while the building and its maintenance are county, and this partnership allows us to uphold a high standard of forensic and academic excellence to an underserved population. We have a large conference room that can accommodate 50 people, which we fill to capacity each year with a week-long seminar that we host aimed at medical legal death investigators, law enforcement, attorneys, and local medical examiners. Our investigators work around the clock, taking approximately 19,000 death calls each year, going to scenes, and acting as the liaison between our office and families, law enforcement, and hospitals. As you enter our autopsy suite, the PPE station is by the door so that proper precautions can be worn at all times. Fellows are given their own PAPR to use as well as all other PPE. Student and resident rotators bring their own PPE with them. Also at the entrance is an office, storage rooms, as well as our stock room. The autopsy suite consists of 7 autopsy bays or stations. Each station is equipped to perform 2 autopsies at one time. Wayne County utilizes the unblock evisceration. We perform our cases concurrently as opposed to one case after the other, and we are very efficient at multitasking. Opposite the autopsy stations is an enclosed observation area for police, students, and other approved observers. And we autopsy under skylights that are augmented with artificial lighting. We have 2 full-time biomedical photographers that provide continual coverage, and we take full-body anterior and posterior photos of every case, as well as more detailed case photos in required cases such as motor vehicle accidents, homicides, pediatric cases, and suicides. Next to our photography room is our imaging room. We are equipped with a new, as of August 2020, XRO-DR full-body Lodox. We typically image cases of homicides, motor vehicle accidents, water-related deaths, severe decomposition and skeletonized cases, and pediatric cases. Other areas of our autopsy suite that are not shown is an isolation room, our morgue refrigerators and freezers, which can store up to 200 bodies on site, and the receiving area where we receive and release the cases. While the first floor in autopsy suite is where we spend our mornings, the second floor of our building is where we spend our afternoons. It contains our library, conference rooms, and rotator rooms, as well as the personal offices and spaces. Each attending, as well as the fellow, have their own office to allow for privacy and social distancing. Now that you are familiar with our building, let us take you through a typical day at the Wayne County Medical Examiner's Office. Our work can only be done as a team, one whose success depends on each member's participation. The day begins in the post room. The autopsy technicians prepare for the day by pulling out the day's cases, taking the identification photograph for each case, and lining them up for morning rounds. Morning rounds begin at 8:30 a.m. This is where we inspect the cases for the day. All attendings are present to assist in decision-making. Also present are the supervisors, autopsy technicians, fellows, pathologist assistants, photographers, investigators, and rotators. As you can see, it's a pretty full room. We are a major teaching institution with, on average, 2 PA students, 3 to 4 medical students, and a pathology resident rotating with us each month. A lot of our teaching is hands-on during morning rounds and throughout the morning as the autopsies are being performed. After morning rounds, there is a huddle where the attendings assign the cases. All of our rotators perform autopsies after orientation and onboarding, always under direct supervision and in keeping with each attending's discretion and level of comfort. As the cases get their external examinations, they are photographed and x-rayed if needed. The autopsies are then performed. We have 7 autopsy attendants who eviscerate and take toxicology specimens. They are also trained and supervised to retrieve bullets and take trace evidence, and remove the brain, eyes, and additional specimens as needed. Wayne County staff all have PAPRs and appropriate PPE. Our 3 pathologist assistants are available to assist in the dissections and the supervision of rotators. A typical caseload is currently about 10 cases, and they are all done concurrently with the goal of having all the cases completed by 1 p.m. Multitasking and appropriate supervision make this possible. The bodies are then released to the funeral homes in the afternoons by our autopsy technicians. At 2 p.m., the attendings, fellows, pathologist assistants, and rotators meet for afternoon rounds. This is where we review the cases after autopsy and discuss the cause of death and manner of death for each case. Relevant teaching points are covered, and at its conclusion, everyone is familiar with every case for that day. The rest of the day is then utilized for report writing, research, teaching, and other activities. The Washtenaw County Medical Examiner's Office is located in the Department of Pathology at the University of Michigan, which is located in a separate research complex called NCRC. The NCRC is home to both pathology and engineering, and it has an open, communal, and flexible workplace floor plan. The fellows have separate workspaces that contain a microscope, 2 monitors, and a laptop. The Autopsy Suite contains 2 rooms. One is the observation area where morning rounds are held, and it looks down into the autopsy room itself. The autopsy room has 3 stations and a separate negative pressure room where infectious cases and decomposed cases are autopsied. Washtenaw County utilizes the organ-by-organ evisceration, and cases are performed concurrently, and thus multitasking is required in this office as well. The daily schedule in the Washtenaw office is similar to that in the Wayne office, except that the morning huddle occurs a bit later in the morning. Usually, only 1 medical examiner is on service for any given day, and the fellow works directly with that medical examiner throughout the day, eliminating the need for an afternoon consensus conference. Regarding other laboratory studies, histology is done at the University of Michigan. Tissue is sent every Monday, and we get our slides back the following week. We also have the ability to get basic special stains through U of M labs. We do not have an in-house toxicology lab. Instead, we utilize NMS Laboratories in Pennsylvania. We take toxicology on every case with the exception of natural deaths that only get an external examination. We ship the specimens via FedEx every day except weekends and major holidays. We receive results within 11 to 14 days for more routine cases, and we receive 95% of results within 28 days for more complex cases. We have a toxicologist dedicated to our account, one who used to head up our in-house lab back when we had one, so he is very familiar with our office and our population. Because of our affiliation with the University of Michigan, we are capable of doing many other studies such as microbiology and molecular testing. And we have been consistently doing COVID testing since the start of the pandemic and have been doing complete respiratory virus pathogen panel testing throughout. Our fellowship is designed to take advantage of all that we have to offer, to best train you in forensic pathology so that you are comfortable with all types of cases. We recognize that a career in forensics is not just about cases, that it can include academics, education, and administration, and it can take place in small or large jurisdictions. We strive to give the fellow exposure to all of this and provide a solid foundation of which to start your career. We offer 2 fellowship positions per year. We are not participating in the Forensic Pathology Match program, slated to begin in 2024, and instead have a rolling admission process where interviews and offers are done throughout the year and well in advance of the year you are applying. Our fellowship is divided between 2 offices, the Wayne County Medical Examiner's Office in Detroit and the Washtenaw County Medical Examiner's Office in Ann Arbor. As a fellow, you are considered a house officer at U of M and are thus governed by their salary, vacation and time off, and discretionary funds for travel. Both fellows start in Detroit for the first 2 months and then alternate independently between the offices on a monthly basis. As a fellow, you will perform 1 to 2 cases a day, and your caseload is monitored so that you do not exceed the ACGME guidelines of 250 cases. Rotating through both offices gives you the experience of working in a large urban office as well as a more rural or suburban office, and in a more county-run operation as well as a more university-run operation. You get to experience all of the day's cases being examined and learn from them, even though your caseload is being monitored and limited. And as a fellow, you get the first pick of cases with the focus on the more complex cases, homicides, and pediatric cases. We utilize both methods of dissecting the organs. Wayne County utilizes the block method of dissection, and Washtenaw County utilizes the organ-by-organ method of dissection. At both offices, Wednesdays are considered paper days, and fellows do not cut cases. This gives you time to complete reports, work on projects, and keep your caseload under control. Fellows work every other weekend during their fellowship. These weekends are in the Wayne County office, regardless of the site at which you are at for that month. Fellows are off the Friday after a worked weekend, and you do not participate in pager or evening call. The caseload at Wayne County is high. It is this volume that gives us our vast experience and expertise, research ideas and opportunities, and material for teaching. It is also the basis for our multitasking and team approach of workflow design. This is the data of cases in Wayne County from January to June 2020, a 6-month time period. In that time, we had 1,791 cases, including 1,288 full or limited autopsies and 504 inspections or external examinations. This is higher than normal for us. You can see in the monthly graph that the pandemic has increased our caseload from April onward, as it has for all of the United States. For us, this increase is not just in direct COVID deaths, but in all deaths: the natural, drug-related, traffic fatalities, suicides, and homicides. Overall, as you can see in the pie chart, while most of our cases consist of natural deaths and drug deaths, there is a fairly high percentage of traumatic deaths. And although this may seem like an overwhelming number of cases, remember that you have a team to get the work done, and that team has 3 PAs, multiple rotators, and all of the attendings. The caseload at Washtenaw County is commensurate with its population size. Here is the data of its cases from January to June 2020. In total, there were 349 cases, and like Wayne, this is higher than usual and reflects the direct and indirect results of the pandemic. Washtenaw has a higher percentage of natural and drug deaths than Wayne County. Our fellowship is vigorous and competitive. We educate through a combination of didactic lectures and hands-on training. We strive to not just produce competent forensic pathologists, but innovators and future leaders. And as such, we are constantly adapting our program to take advantage of learning opportunities in this ever-changing world. We have the fellow identify an attending mentor who provides guidance throughout the fellowship and beyond. We provide a lecture series in topics of forensic pathology and toxicology. We have many conferences, including histology unknowns, toxicology unknowns, difficult cases, and manner of death scenarios. The first 2 months spent at Wayne County focus on learning the technical skills such as evisceration, special dissection techniques, x-rays, and photography, on which experience is then built for the remainder of the fellowship. We require scene investigation at both offices with our investigators. We require working on at least one research project with the goal of publication, as well as completion of a quality improvement project and a patient safety project. Additional conferences and courses offered are the MAME, NAME, and AAFS annual conferences, for which U of M GME funds are provided, annual NMS toxicology course, rotation through 2 Michigan crime labs, and an in-house anthropology course. Wayne County has a very busy and quick criminal court system. Fellows participate in a mock trial held in conjunction with the Wayne County Prosecutor's Office and observe medical examiner testimony. Due to the short turnaround time between death and trial, fellows will testify during their training and receive feedback from the medical examiners. Our affiliation with the University of Michigan has greatly aided our ability to do research. Here is a list of our most recent publications. We also have the ability to fund projects through grants, through which several of these projects were enabled. Education is one of the cornerstones of our office and is an essential part of everything we do. Because the Wayne County Medical Examiner's Office is in the heart of Detroit, we have the opportunity to instruct through lectures and hands-on learning the pathology residents from all 5 Metro Detroit training programs and medical students and anatomic pathologist assistant students from Wayne State University. Because the Washtenaw office is in Ann Arbor, we also have the opportunity to instruct and train medical students and residents from the University of Michigan. We also provide several lecture seminars to our community, including the Medical Legal Death Investigation course, as well as a Forensic Nursing seminar. We host a Forensic Pathology conference series for the residents that is a combination of didactic lectures and case presentations. We recently converted this to an all-virtual format that was met with great enthusiasm and attendance. We also participate in interdepartmental conferences with radiology and emergency medicine departments in the area, as well as participate in child death review teams. We here at the Wayne County Medical Examiner's Office have recently embraced social media as a way to increase awareness about forensic pathology as well as public health within our community. We started a podcast called Detroit's Daily Docket, which just finished its 2nd season, and it provides the public with easy-to-understand instruction in topics in forensic pathology, as well as highlighting all the members of our team that work behind the scenes to get the work done. We also have an Instagram page and Twitter page focused more on forensic education at the Rotator level that utilizes our vast collection of images. All of our graduates have moved on to successful careers and are still in contact with us. And as you can see, 4 out of 5 medical examiners on staff in the Wayne office were former fellows, and thus we have a practice of retaining our graduates. Thank you for your interest, and if you have any questions, please do not hesitate to contact any of us.